Hello, everyone. We'll take a few minutes and let others join the webinar, and then we will get started. All right, everyone, welcome to TMA's Ask the Doc webinar series. I'm Rachel Bromley, TMA Senior Manager of Patient Education, Support, and Advocacy. And we absolutely love having our guest panelists on about everything we do. She just spoke at the conference. She was at a virtual summit. We've done some webinars, and now we are so happy to have her on our Ask the Doc series for this season. And I am talking about Dr. Helene Alexanderson, and let me get her on. Hi, how are you?
Hi, Rachel. How are you? I'm good.
Well,
And
why
you?
don't you tell the audience a little bit about yourself and your work, and then we'll get going on the Q&A. Now, we will go until all the Q&A is complete. So if you have questions about, therapy in general, go ahead and start putting it in the Q&A. All right, Dr. Alexanderson, go ahead and tell us about your work.
Thank you so much, Rachel. Hello, everyone. And I want to congratulate TMA and all of you on the World Myositis Day. Did I say that correctly? That's fantastic. So I have been working as a physical therapist at Karolinska University Hospital and Karolinska Institutet in Stockholm, Sweden for the last 30 years. And 27 of these years, I have focused mainly on seeing patients with adult myositis, and also focus my research on understanding if patients can exercise. And luckily, we have seen that exercise is safe for everyone with myositis. But now we are wondering, why do muscles get weak? What kind of exercise program are most optimal for people with different subsets of myositis? And I'm also very interested in the further development of patient-reported outcome measures, as well as to understand more about how people with myositis experience pain and fatigue. So I'm happy to be here with you today, and hopefully I can answer all your questions.
So I was wondering, when you got started with myositis, was it prevalent thought at that time that that myositis patients weren't supposed to work out or exercise?
Yeah, definitely. When I saw my first myositis patients in 1995, I had a question from Dr. Ingrid Lundberg. Say, what do you think? Can these patients exercise or not? So I started to look for literature, and there were almost no studies. There was one case report saying that in one patient saying that it might be safe and beneficial, but in the textbooks it said that if you have an acute onset of myositis, or if you're on a flare, you should definitely only rest. And maybe if you are in a more stable phase of your disease, you can do something very careful. So that was the knowledge base when I got started.
So what led you to change your mind about that they could exercise, and did you conduct studies that supported that, or just give us a little bit of the history of that transition?
Yes, Dr. Lundberg, she had a patient, a young man who was a construction worker, and she had advised him, I think he had dermatomyositis, and she had given him the advice not to exercise. But he did not obey this advice. So because he was used to exercise, and he came into our office one day and did a lot of push-ups on the floor. So that's what got Dr. Lundberg thinking, well, maybe they should exercise. And so she asked me, and I developed an easy intensity home exercise program and that's the program that is up for PM and DM patients on the TMA website. So I developed that, and we tested it first in 10 patients with low active established polyandromatic myositis, and we saw that they improved in muscle function and aerobic capacity, while there were no changes in CK and no signs of increased muscle inflammation in muscle tissue, as well as on MRI scans. So that kind of got us a little bit assured that maybe we're onto something. So after that, so I think this was published in 1999, and then I published another study the year after with patients with recent onset acute myositis, and they did the same home exercise program, and we did see even more improvements in muscle function with reduced inflammatory infiltrates over time, as well as CK levels after 12 weeks. And so we have kind of built on our exercise studies as well as other group studies, and really have tested much more intensive strength training. And now we're testing high intensity interval training in patients with early myositis. And from what we have seen in ours and other studies are that this type of intensive training can really reduce disease activity and inflammation, as well as reduce fatigue and improve muscle function and aerobic capacity and quality of life. So now we believe that exercise is a disease-modifying treatment it's like an additional medicine that you give in addition to your medical treatments.
Well, so is the current belief that it can, I believe the current belief is that exercise can slow the progression, but can it rebuild muscle? That part I don't know.
It's true for people with IBM that it can slow down the progression of the disease. But for all other subtypes of myositis, it's definitely possible to rebuild muscle health in terms of contractility and mitochondrial function, and that can reduce inflammation, but you can also improve muscle endurance and muscle strength and aerobic capacity.
We have a question from someone with IBM. Their legs and arms are very weak. If an exercise is very difficult without weights, is it still beneficial to try working through it?
I think it's important that you are able to perform the exercise without doing too much of compensatory movements with your trunk, for example. So, because if you have to kind of bend your back backwards or sidewards to be able to lift, then I would say it's too much. So maybe it's better to do qualitative movements, but perhaps only against gravity. Or you can use, you can adapt the training exercise to maybe with assistive work against gravity with assistance, or if you're laying down. So it depends. If you're sitting up, then if you're lifting your arms, then you need to work against gravity. But if you sit more backwards, or if you lay down, then perhaps gravity will help you. So it's important to think about the position that you're training in.
Okay, what is the mechanism by which exercise slows IBM progression?
I would say that we don't know that for sure, but our hypothesis is that we know that the disease will break down muscle tissue. So if you don't exercise, then for sure you will lose muscle tissue and strength. But so we believe that if you're exercised and you're working, you're activating your still healthy muscle fibers and you can train them. But we also hope that it's possible to activate the satellite cells, which are baby muscle fibers that can grow out. With activation, they can grow out to become new muscle fibers. And with that in mind, your muscles would be working properly for a longer time. We also know that exercise improves vascularization of muscle. So in that terms, if you train, you would keep or maybe further develop more vessels in the muscle that will contribute to a better oxygen flow to the muscles. So there are different ways that we think that exercise can work, and I'm sure that we don't know. There's still much that we don't know about disease mechanisms for IBM and how exercise can help. So, for example, the blood flow restricted training that has been shown to be beneficial in IBM. There that kind of training, you take away 70% of the oxygen to the muscle, and that really triggers the muscle to improve muscle growth. So that's another way that we believe that since muscles regenerating capabilities are disturbed in IBM, we think that this is a way to maybe boost muscle growth.
We have someone that first off wants to thank you for setting up and doing this session. We always appreciate you. And then they go on to say, before getting ill, I was extremely active, climbing, hiking, running. I have anti-synthetase syndrome plus DM, and I'm in my 30s. Despite being in near remission, I find that exercise puts more strain on my heart. Will the feeling of strain on the heart ease over time, or is this a sign that I'm overtraining?
Maybe this person can further develop what they mean with strain on the heart, because you will get your heart rate will go up when you exercise, and you will have dyspnea, which is also good. So with this type of aerobic training or activities, you actually train the heart as a muscle, and also the whole body aerobic capacity. But I think it's important to adapt to your physical fitness. So if you have a very low fitness, then it's important to do lower intensity training, maybe several walks per day with some rest in between, and then go in on a low level, and then try over time, could be weeks or months, try to increase what you're doing. So is it possible that a person can explain a little bit more about strain on the heart?
The person with the heart strain question, please put a little bit more information in the Q&A, and we will come back to your question. Let's see. This person has dermatomyositis and their physical therapist has them doing the blood flow restriction training. Is this a good way to regain strength, or would a different type of training be more effective?
We don't know which type of training is more effective. And especially we cannot say for which training is optimal for different subsets of myositis. That is actually one dream study that I would like to do. There is a study from Brazil looking into blood flow restricted training in PM and DM, and they could see markedly improved muscle strength. And I also believe that they could see some changes in muscle fiber area, so indicating that this type of training boosted muscle growth. But we cannot say if this has a better effect than doing regular strength training on perhaps a little higher loads, lower repetition. But I think some patients can experience the blood flow restricted training as somewhat uncomfortable. It can be a bit painful. But otherwise, I wish I could answer that question. Hopefully we can come back in a few years.
I was very active prior to DM. I had been on treatment and in physical therapy for 5 months. And while I am making gains in strength, it is hard to imagine ever being back to where I was. For example, being able to go on a multi-night backpacking trip in the mountains. Is it possible to return to a high level of physical activity?
It is, but I would say it takes time. Usually I say to someone who is newly diagnosed that you should see a year ahead and try to build up your muscles and aerobic capacity over this time. And I would say one factor that is important is how long time you had the symptoms until you got your diagnosis and started on medical treatment. So that is so if you have had your symptoms for several years, there is a higher risk that you have muscle damage in your muscle, like necrosis and fat infiltration. And of course, if you have that, then it's going to be more difficult to train your muscles. But within a year, I think 1 year or 2 years, I think it's quite possible to regain where you were. And I think it's easier if you are younger, because at age 50 somewhere, this natural aging of the muscles kicks in, the sarcopenia. So then you have also that to combat, not only the muscle myositis, but you also have this natural muscle degradation that we have, all of us. So I also had to combat that factor. But I would say...
I just turned 50. Thank you so much.
Congratulations. But if you exercise, and it's never too late to start.
Well, right now I'm just
exercise.
running. I probably need to do some weights also. So, but this isn't about me. That question made me think, though, she wants to go, or they want to do a multi-night backpacking trip in the mountains. Is that something to where, like, you've done what you said, you've got a year of making sure that you've trained and your aerobic capacity is there? I mean, do you still, like, how remote can you be? Or do you feel like that person should still be relatively close enough to, emergency medical providers? Or
I don't think that you need medical providers, but I wouldn't go on a long hike away from civilization on right away the first time. So I think if you have this important goal that you want to go on this type of hikes, I think it's important to start going on shorter hikes in your neighborhoods, and then increase the difficulty of your hiking, and always have someone with you, maybe a walking stick in the beginning. So if you come into very uneven terrain, then you can have a support. So that's I would say, start building slowly. Go on 1 hour hikes, then increase to 2 hours, and then slowly see how far you can get. But I would say definitely don't take away this goal.
Should you alternate between lower body and upper body, or is it okay to do both every day?
I would say you should train all of your muscles every time you train. So you can think about that the effects of an exercise program stays for about 72 hours. So if you're training your shoulder muscles on Monday, then on Thursday, you need to train the same muscle groups again to be able to improve your strength. So I have seen in my clinic, I've seen much better results of whole body circle training 2 or 3 days a week compared to only training your arms once a week and then only train your legs once a week. And I think the circle, at least if you are, if you have severe muscle weakness, doing a circle training is important. So if you start with a warm-up, then your legs will be a bit tired. Then you do training for your arms and trunk muscles, and then you can do something with the legs, and then so you kind of move through the different muscle groups in your body, but always in the same session.
Are there research studies with control groups showing benefit of BFR training for IBM? I think you might have answered that one already. I don't think we have current studies.
There is one study published. It was a Danish group who had 11 patients with IBM doing the BFR twice a week, and then they compared this to a non-exercising control group, also 11 people with IBM. And they could see that they measured muscle strength in the quadriceps, the front of the thighs muscles, which are one of the most affected muscle groups in IBM. They could see that the training group, they increased their muscle strength by about 6%. This is a quite small improvement, but still it's a little bit better than at baseline. But the control group worsened by 10% in the quadriceps during the same 3 months. So I think this study really shows that BFR training can be beneficial for IBM compared to not doing anything at all.
Someone with IBM wants to know if they should do exercises every day. I mean, how do you know if you're doing too much or not enough, or, striking that balance is hard for anybody, much less someone who's dealing with myositis.
Yes. The home exercise program that I give to everyone with IBM, it was developed, it's a short program. It takes about 15 minutes to do. It was evaluated in a small study from Australia, and people in that study trained twice a day. So very short sessions, but twice a day. So when I initiate this training program for my patients, I say, so we find a number of repetitions and weights that will generate a moderate exertion from the beginning. And then I say, try to do this once a day at home. And then I call them and ask, so how have you been doing? How many times a week or a day could you do this once a day? And how was it afterwards? Were you tired? Did you have muscle soreness? And if the patients say, well, I did it once a day and it kind of worked and I'm feeling okay. So then I can say, well, try to do 2 of the exercises that you feel is most relevant to you. Try to do that at 1 additional time per day. And so I think it is difficult to know when am I doing too much. So I think if you can recover within 15 minutes or maybe 30 after an exercise session, then I would say, well, it is good, and you don't experience increased muscle soreness over several days, and you don't have excessive fatigue, so that you're bedridden the next day or you're prevented from doing your regular activities. So that's kind of 2 signs indicating that you're doing too much. So then you have to slow down. And I don't think it's not harmful to do too much from time to time. It will only you will only learn that, okay, this was too much for me at this point. But I'm also convinced that there are several subtypes of IBM, because some patients can really tolerate a lot of exercise, several hours per day. And they can also improve, like our friend Joe in Texas. And then there are, like, I think most people would probably tolerate doing this exercise program daily or maybe 5 days a week. But there are also a small group of people who do not tolerate it. So there you have to think about other ways to.
And when you say they don't tolerate it, how I've heard people say, I'll work out and then that wipes me out for the whole next day. I can't do anything the next day. So is that just recovery that you can expect, or does that mean, no, I'm not tolerating it?
Then you're doing too much, I'd say. So I think if you're okay within 30 minutes and you can, after resting, because you need to become tired in your muscles to have a good effect. But then if you can recover within 30 minutes and feel okay, maybe you're a bit tired the rest of the day, I think that's fine. But if you're totally wiped out the rest of the day and the day after, then I would say you're doing too much. Maybe you're doing too much too fast. So I think also in IBM, go in slowly and less frequent and see how much you can build up to, instead of going in hardcore.
Well, whenever I hear a high intensity interval training, it always sounds hardcore to me.
It is. But we haven't tried that in IBM. So that's for all other adult subtypes. And it has been working really well. The training protocol that we test now is that you bike for 5 minutes on a easy level to warm up. And then they start all out bike for 30 seconds. So we increase the loads and they increase the pace, and they bike until they say this is very, very heavy exertion. And then they rest for 2 minutes, and then we go at it again on a maximum of 6 sets. But of course, we have initiating this, we start with 3 sub-maximal sets. And then we do 3 maximal sets. And then slowly working up to 4, and then 5 and 6 maximal sets over 3 weeks. And of course, they're very tired, but after 15 minutes of stretching and cool down, they're okay. But I think maybe this high intensity interval training is not for everyone. So this is very important that you do together with a physiotherapist. And I'm not sure that I want to recommend this type of training yet, because we have just finished. We have completed recruitment. So we have 20 3 people who have completed the study. And we compare this to the easy to moderate home exercise program that we have been using for many years. So when we have analyzed all the data of aerobic capacity and muscle function and looked more further into serum analysis of cytokines and inflammation in muscle, hopefully we will know maybe who we can recommend this type of training for. But in clinic, I mean, they have liked it. They have tolerated it, I would say. But it's important to move in slow and carefully.
Okay, someone is actually doing it in this next question. They are 59 years old. They've had 2 polymyositis flares. The last time it was difficult to lift a fork to my mouth, stand for more than a few minutes to climb stairs. For the last 6 years, I've been doing high intensity interval training 3 times a week and walking regularly. I can walk 8 to 16 miles a day easily, but I still have trouble climbing steeper hills, and I can't do jumping jacks or do a deep squat. Do I need to keep working on this, or is it possible I won't ever be able to do these things again because of muscle damage?
Difficult to say, but I mean, it seems that this person is have come a long way, and so I would say continue. Maybe work more on your core muscles, because those are extremely important if you want to do jumping jacks and do more complicated whole body exercises. But I would say continue and try to build up, set smaller. I mean, maybe you have a long-term goal, but also set smaller short-term goals where you want to be. So I'm rooting for you.
We all are, for sure. And I think also you've said in the past, or maybe I just inferred this, but depending on how athletic and how much they exercise before the diagnosis, doesn't that kind of influence what they are able to do after the diagnosis?
We know that we know that physical activity levels before a diagnosis is the strongest predictor to if you're going to be physically active with your disease. So that's what we know. But it's difficult to say. I don't think that we can say that previous physical activity levels will predict what you will be able to do, how fit you will be able to be with exercise, because we have all these different subsets, and there are within each subset, it's quite heterogeneous how you tolerate medication and how much damage you have from the disease. So it's not possible to say. So it's only time will tell how far you can get with the regular physical activity and exercise.
Okay. What exercise would you suggest for folks with advanced IBM, as in they're already wheelchair bound?
I think it's important then that you have that you can train with a caregiver or a physiotherapist who can maybe assist you in movements. I think it's very worthwhile training your balance in sitting. There's a lot of exercises that you can do laying down to work with your core muscles. And the IBM program on the TMA website has adaptations for most of the exercises. So showing this is what you can do if you can work against gravity, and also suggestions on what you can do only sitting and also laying down. So I would suggest to see a physical therapist and see what you would need help with and how you could adapt your training positions to make it the best. And of course, maybe I would say it's important to train those other muscle groups that are less affected by the IBM as well. Maybe go into a pool, if
Oh, the
possible.
pool aquatherapy. I hear so much about that.
So if you only have help to, get change clothes and shower and get into the pool, then then it's fantastic.
I didn't mean to laugh while you were talking. Someone is saying something funny in the question and answer box.
Let me know.
I was like, I couldn't help it. Let's see. I had a question about, since that brought that up about the wheelchair bound. I've heard different people say, and not doctors, so I wanted your opinion on it, that if you start using a wheelchair too soon, then that can affect your muscles and make you dependent on the wheelchair. Is there a case for that?
I guess so. If you get a wheelchair and you get a little bit comfortable in that chair, maybe doing less than you might be able to do, I would say, then maybe it's a risk that you will lose faster. So I think that even though you might need a wheelchair to move around outdoors, so I think it's important to see if you're able to move around and so indoors or a shorter distance, maybe with sticks, or there are these walk-on reaction foot orthoses that can help you to lift your toes when you're walking and help you improve your knee control. There are braces for the knees and do balance training. So I think it's, in that sense, if you get a wheelchair too quick and maybe you start doing less than you would. But on the other hand, I think it's extremely important that you can move around safely. So I guess it's a balance.
It's hard to, I would just assume it's hard to know when. Because of the fall risk also.
Yeah. So I would say it's the fall risk and also the anxiety and fear of falling. So you feel that is limiting from doing important stuff. So maybe then a wheelchair would be good for moving around outside. And if you want to go out walking with your partner or friends, so maybe that is excellent to have a wheelchair, electric, so that you can be out and about and participate in society and be social. So I think different individuals have different views about assistive devices and wheelchairs. So I think that's very, very different there in how we think about these things.
Okay, in the context of DM and/or antisynthetase syndrome, have you observed muscle spasms and/or myoclonic jerks? I've had these symptoms as part of my DM, which improved under treatment, though I haven't read much in literature about them.
So muscle spasm, that's maybe I'm interpreting that as a cramp, maybe. So I think a lot of my patients talk about this and think that this is difficult to cope with. We don't know why muscle cramps or spasms are there. I think it's a very important question. So when we interviewed a lot of patients in the US, Sweden, and South Korea and did focus groups, and people talked about muscle symptoms. So I think that can be part of that entity muscle symptom that we really don't understand fully what it is.
Okay. Can a physical therapist use a dynamometer to compare muscle strength to healthy population norms, or can it really just be used to track within-person changes?
Um,
First
I say
off, what
some,
is a dynamometer? That would be nice to know.
it's a hand, I think they mean a handheld dynamometer. So when this manual muscle test is very often used to test muscle is static muscle strength in myositis. So, for example, you test the deltoid muscle, and so if you can lift up here, you get a 5 point, and then if the physician can put external pressure that you can resist, you will get higher points. One problem with this is that it's very subjective. It kind of depends on the strength of the assessor, also as much as to the strength of the patient. So are different kind of handheld dynamometers that you're holding. So with this device, you put pressure on the muscle, and then you can get a number on how many newtons can the patient actually press. So you get a more objective number on muscle strength, and depending on what type of dynamometer is used, there can be, if you're lucky, there are some research done in healthy people giving you some reference values on what would be normal in men and women in different ages. There is a type of dynamometer called the biodex, which is more complicated. It's a moment arm that you attach to the ankle, for example, and then you extend the knee and bend the knee, and then so this moment arm is connected to a computer, and this they have a sensor measuring how much power you can develop. So that's, I would say, the most accurate measure of muscle strength. But it's, on the other side, this is a very expensive device, and you need a lot of training to be able to do it. So yes, your physical therapist can probably use one type of these handheld dynamometers.
Okay, I ride a recumbent bike 5 days a week. When I increase the resistance enough to feel an aerobic effect, increased heartbeat, my quadriceps become fatigued much more quickly. Which is best?
Good question. So one advice would be to start on a very, very low resistance so that you just get the circulation going, maybe for 5 minutes, and then increase the loads. I think the chances are that you can continue for a longer time improves. So with this, so I guess it's trying to keep it on a level where you can still get your heart rate up, but not getting so fatigued in your quads that you cannot paddle anymore. Another way is perhaps to do it in intervals, so that you train for, maybe you can bike for 5 minutes, and when you feel that your leg muscles are getting too tired, then rest for a few minutes. Maybe you can do another type of training, lifting your arms, so that you will keep your heart rate going. And then when you feel that your legs are a bit recovered, you can do another set of biking. So that's another way to do it. Biking, and maybe you can bike, and then you can, if you have an arm ergometer bike, so you can only work with your arms for a while, and you can maybe go on to a rowing machine, so that you do different types of exercises, but in shorter bouts. So maybe in that way you can kind of prolong the time that you can train, and then you will get a more significant aerobic exercise effect.
This person feels a lot of malaise after exercise, headache, nausea, just feeling almost ill in addition to tired. Have you ever seen this in other folks? And are there exercises that might help avoid this?
I think then you're doing too much. I'm not sure how long workout sessions you have. But that would be a sign. If you're not feeling well after your training session, then it's something wrong. I mean, you're tired is one thing, but if you feel nauseous and almost sick afterwards, then maybe you're doing it on a too high intensity or too long. Maybe have you tried a circle training instead, changing muscle groups? Yeah, that's it seems like you need to change something there.
Okay. What type of braces have you found effective for IBM where there is knee hyperextension but no foot drop?
So knee up. I'm sorry, was it not for foot drop, but for
They
knee?
didn't have foot drop, but they do have knee hyperextension.
I think this is a bit tricky because there are these braces that you have around your thighs and underlegs that you can lock so that you cannot bend your knees more than 20 degrees or something, and may also stop you from doing hyperextension. One problem with these braces is if you do fall, you will fall like a timber, and you can hurt yourself, like hurt your head. But I've had a couple of patients who use these kinds of braces and make it work. But I think this walk-on reaction foot orthosis can also help you to increase your knee control a little bit. So that might, even if you don't have a drop foot, those can actually help you to increase the knee control as well. So it could be worth trying.
In my area, physical therapists, massage therapists, stretching facilities do not know about myositis. I have DM. Do you have any recommendations on what they should know or be aware of from the beginning?
I think I would advise them to go into the TMA website, because there they can find a lot of basic information. What is dermatomyositis? What are the symptoms? What is the treatment? And there is also this home exercise program. And if this physiotherapist is interested, I mean, there are literature online to find more research articles. And there's a lot of, I've written several exercise review papers. So kind of explaining, going into some detail about the exercise program, but also what you need to think about, what you need to be aware of. So I guess it's important for them to know that this is an autoimmune disease that can go in flares, and that you can have reduced muscle strength and endurance, but that you might also have lung disease and what your skin disease is doing, and the side effects of corticosteroid medication is very important for your physiotherapist to know about, since, I mean, there's a higher risk of osteoporosis, and your muscle tendons can become fragile. So I think those are maybe the most important things. So I would say to all of you, if you don't have a PT who knows anything about myositis, I mean, we have to educate them, have them going into the website, and I welcome everyone to contact me. So if you can say to your physiotherapist, you can contact me in Sweden on email, and we can have I can give further support. But there are also, if you live closely to, in Baltimore, they do have this whole neuro rehab team who are very knowledgeable. So ask your PT, is there any way you can find a health professional with more knowledge who work at a myositis center?
And it can be frustrating for people with myositis to have to educate their therapists, but a lot of times that is what we have to do. And I do think the physician's guide that TMA has is also helpful for the therapist. Would you say that therapists that work with certain disease types might be better equipped to help with myositis, like if they have neuromuscular experience or?
I would say rheumatology or neuromuscular. I don't know how it is in the States, but here in Sweden and other Scandinavian countries, you can as a PT, you can specialize in the area of rheumatology. So if you can find someone who sees patients with other types of inflammatory autoimmune diseases like rheumatoid arthritis, or I would recommend that, or maybe even osteoarthritis. But of course, neuromuscular disease as well. Although I think in neuromuscular disease, they are more careful and afraid of damage from training than we are in the field of rheumatology. So I think there are some muscle dystrophies that should really have different exercise guidelines than people with myositis. So I think it's important that the PT reads up about current knowledge in myositis.
Yeah, that is key. If they're open to learning more and putting in the time instead of just giving a boilerplate program, that's definitely a green flag, and a red flag if not.
So we hope that soon that we will be able to create these CME courses. I think I'm saying it right. For healthcare providers, and we're also publishing international guidelines for different types of exercise and subsets of myositis. So hopefully soon it's going to be easier for healthcare providers to educate themselves. But I think still you need to tell them, say, hi, I have this disease, please read up.
What research has there been done in exercise with people of color with IBM?
That's an interesting question. I don't think that there has been any particular studies only including colored people with IBM. I'm not sure. I don't think that we know if there are any kind of genetic variation in how, or I would say I don't know how the genetics can differ, or how the genetics can have different symptoms or severities in IBM. I'm not sure if I make myself understood now. I'm sorry. But that's an really interesting question.
We've only got a few minutes left. I'm trying to get to as many as we can. This person was diagnosed with polymyositis this past May. Might there ever be a reason for not being prescribed or engaging in physical therapy? Are daily living activities enough to rebuild muscle strength?
I think if you have extreme muscle weakness or low fitness, then I'm sure that daily activities is exercise enough. But otherwise, but even though this is the case, I would say maybe you need some more very specific exercises for some specific muscle groups that you need to do. So I would say no to that question. I think exercise, physical therapy is always warranted for all people with myositis, independently on disease stage or how they're doing.
With someone with DM for muscle recovery, what is best? Hot or cold therapy? For example, would sitting in a sauna help, or hot stone massage, or cold like cryotherapy or ice baths?
That's also a very interesting question. I would say, the cryotherapy. I mean, there are some data suggesting that this can actually reduce your inflammation. But then on the other hand, I'm not sure that we know that stepping into a sauna would have the opposite effect, increasing your inflammation. I don't think so. So I think it's more what you enjoy, what you feel is comfortable. Maybe if you have a lot of stiffness in your muscle, then I would probably think it's more nicer to going into sauna would help with that, or maybe both. But we don't know. Actually, that's another a good suggestion for research study.
This person has trouble going up steep ramps and stairs, but usually less trouble getting up from a chair. What muscles might I work to improve my stair climbing ability?
I would say that I would say maybe you are weak in your hip flexor muscles. If that is the problem, lifting your foot up on steps. If that is the problem, I would say include more hip muscle training, hip flexor, hip extensor, hip abductor, and the core muscle, if that is the problem.
I was trying to Google a word. You and I can figure it out together. Let's see. I have dermatomyositis, diagnosed a few months ago, and experience a lot of tremulousness, particularly with isometric exercise. Is this something that is often seen in DM, and will it improve as I gain strength?
Tremulous.
Yeah, I'm wondering if they mean they tremble a lot. Yeah, shaking or quivering slightly is tremulous.
Mm-hmm.
Yeah.
I guess you would see that if you exhaust a muscle group. Then I mean, then it wouldn't be so strange if you get some tremor and shakiness. Maybe do more variation in what you're doing in one session. Maybe circle training, maybe doing in 2 sets with some rest in between. And I'm wondering how long this shakiness is sustained.
Yeah, the fact that it said tremulousness made me think it was connected with restlessness.
Okay.
So I was a little confused, but you can always follow up at rachel@myositis.org if we didn't answer your question. One last question. Please speak to the need to increase dietary protein as we build muscles.
Sorry, excuse me, please.
is there a need to increase dietary protein as we build muscles?
I don't think that it's necessary to build muscle, although we have this study with using creatine supplementation, showing that you can further increase your muscle strength with this supplementation. So I think it could be a good idea if you feel that you reach a plateau, you're training, but you feel that you cannot take kind of the next steps. So that's when we want to go in and try this supplementation. So it's pure creatine, and you take a loading dose of 8 grams for 3 days, and then 3 grams per day for 3 months. So you take it every morning with your morning drink, and then you train to at least twice a week, if best 3 days a week. And then it's important that you measure your muscle strength before and after 3 months and see if you have been able to gain more. And there is some rationale that people with especially dermatomyositis have lower amount of this phosphocreatine in their muscle, which is very important to build the ATP in the muscle energy cycle. But we don't know if it's important to eat more meat or fish or proteins or not. But I guess a varied diet with proteins would be beneficial.
All right. Well, thank you so much for this time with us. We really appreciate you sharing your expertise, and we look forward to seeing you again on future programming. But everybody was so appreciative and really said thank you in the comments, and I wanted to make sure you knew that. So thank you.
Thank you. Thank you. Take care.
All right. All right.
Bye.
Goodbye, everyone.